Now, before we jump into X-ray interpretation and start interpreting these radiographs and making a diagnosis, we must know a few fundamentals about X-rays. This will enable us, this will create a foundation for us to be ready to interpret those radiographs that we are going to face in clinical practice as well as in your exams. Now, this will include studying a few basics related to physics as far as how the X-rays are included into the electromagnetic spectrum, what are the radiation exposures which are involved, what are the adverse effects of radiations. These are all important topics for your exams as well. Multiple questions have been asked. This will also include a very quick animation based review of how X-rays are produced, what is the X-ray tube, what are the mechanisms of X-ray production when the X-ray tube works, and what happens when the X-ray beam comes out of the X-ray tube and enters into the patient's body. That is what is called as the interactions of X-rays with matter. So let us start this discussion by a clinical based or a clinical scenario based approach. So look at this question. This is also a question which was asked recently in one of your exams. So a 32-year-old patient undergoes a chest X-ray for routine fitness. Later that day, she realizes that her urine pregnancy test is positive. So she goes ahead and does an ultrasound. Ultrasound reveals a 6 weeks pregnancy. Obviously, extremely anxious, she comes to you for consultation. What is the best advice you can give her? Believe me, this situation happens more commonly than we like it to happen or we want it to happen, right? It happens inadvertently and it leads to extreme anxiety for the patient and her family, because we all know X-rays are bad. But precisely when they are asking you what should the management be in this particular situation, this is based on two important topics. One is, what is the radiation exposure that occurs during a chest X-ray, right? One, we must know that. And two, we must know what is the permissible exposure limit. Permissible exposure limit that can be allowed in a pregnant woman. Right? So this is actually a clinical application based question based on these two important topics. We are going to discuss these topics as we go ahead. Yes. So a child with acute lymphoblastic leukemia undergoes prophylactic irradiation prior to autologous hematopoietic stem cell transplant. Which of the following will be the least affected by radiation, right? So they have given you a clinical situation. The child is slated to undergo irradiation, right? And they have given you some tissues. They have asked you which of these will be least affected. This is a very common type of question which is asked. Questions that are based on radiosensitivity of tissues. Some tissues are more sensitive, some tissues are less sensitive or resistant. Though it appears to be a factual topic, remember there is a very, very important concept that we are going to study. And this concept will help you solve multiple types of such questions without actually mugging it up. What is the concept of law of radiobiology? This is something that we'll discuss as we go ahead. Now see here, Laurel and Hardy were brought for a chest X-ray. So Laurel is a very, very, very thinly built guy, whereas Hardy is a very healthily built. The body habitus is very healthy. So naturally, when Laurel's X-ray was done, it was done at 8 kV. What is this kV? And what is this 6 MAS? These are important exposure factors that we must know. And how do they affect the quality of the X-ray image? This is something that the examiner is asking you. Laurel's X-ray is done with these exposure factors. But now, considering Hardy's body habitus, which of the following would be the most appropriate changes in the exposure factors that are required to be done? So this question is basically, asking you about the concept of the exposure factors and how they affect the X-ray image, right? And how they actually must be modified so that the X-ray image quality is improved. We'll discuss this about KV and MAS as we go ahead. Now, before we begin the discussion of X-rays, we must pay our tribute to Wilhelm Röntgen, because Wilhelm Röntgen was the person who discovered X-rays. He was the person who discovered X-rays, and therefore he's given the title of founding father of radiology. It was actually by accident that he discovered X-rays on 8th of November 1895. 1905. See how long time back X-rays were discovered, and because it was on this day that the discovery was made, this day every year 8th of November is celebrated as the International Radiology Day. International Radiology Day, right? So 8th of November every year is the International Radiology. It was actually an accident, as a result of which Röntgen actually discovered X-rays. He was working on cathode ray tubes. So one day, very interesting story. One day he brought a routine photographic plate with him to his laboratory. That photographic plate was totally unrelated to his experiments with cathode ray tube. So when he brought that photographic plate, he kept that plate far away in one particular corner of his laboratory. He forgot everything about that photographic plate. He came to his cathode ray tube. He switched on his cathode ray tube and started doing his experiment. Suddenly he realized that photographic plate, which was kept far away in the room, suddenly began to glow in the dark. Why was the photographic plate glowing? He switched off the cathode ray tube. The photographic plate stopped glowing. He switched it on. The photographic plate began to glow. He was a scientist, so he was trying to determine why the photographic plate was glowing. This is what he actually wrote down in his manuscript when he noted his findings that day. He said, I don't know why the photographic plate is glowing, he said. I don't know it. Perhaps, he said, that there are some unknown rays that are originating from this cathode ray tube that are traveling through space, and they are going and hitting the photographic plate, and therefore the photographic plate is glowing. He said, what are these rays? I don't know. How are they produced? He said, I don't know. What is the energy content of these rays? What are the properties of these rays? He says, I don't know. And therefore he said, let me call these rays as X-rays. What does X in X-ray stands for? Do you realize? X stands for unknown. That was how the name X-rays was actually devised. Though it was unknown at that point, today we know everything about X-rays. We know how they are produced, what is the energy content, what are the properties. But this name, which was given by Röntgen in the first place, is still being retained. That was how the term X-rays was actually coined. Right? So this is how the X-rays were discovered. Now when we discuss about Röntgen, there's another image that I want you to know, and it is this image. And what is the image of the hand that you see here? This image is the first X-ray image which is obtained by mankind. First X-ray image which was obtained by Röntgen, documented in history. And whose is this image? This is the image of his wife's hand, Mrs. Bertha Röntgen. Right? So this is all you need to know about the discovery of X-rays, when it happened, how the name X-rays was actually coined, and the first X-ray, that was documented, the first radiographic image that was taken, that was the hand of Mrs. Bertha Röntgen. So this is about the discovery of X-rays. Now, before we jump into the production of X-rays and the properties of X-rays, we must know that X-rays are a part of electromagnetic spectrum. What are the various components of this spectrum? They are all energy components. Remember, what does this spectrum comprise of? Electromagnetic spectrum comprises of what? It comprises of energy components. X-ray is one of them. Okay. Now let us quickly look at what are the various components of this electromagnetic spectrum. Now in the increasing order of their frequency and energy, the various components of the electromagnetic spectrum are radio waves, microwaves, infrared, visible light, ultraviolet, X-rays, that is our hero there, and gamma rays. Now remember, this is a smart work strategy whenever you prepare for various subjects for your exams, right? Objective, MCQ, competitive exams. The way to study for a theoretical exam when you have to write a long answer and a short answer question is different, because then you have to study in a point by point manner and write the entire answer. But when you are studying for an objective assessment exam, like an MCQ exam, a competitive exam like this, right, the way to study is different. So remember, whenever you come across any table, chart, diagram, and image in whatever subject that you're studying, I always want you to try and frame your own new MCQs on it. And the easiest way to do it, remember, is to just identify what is minimum and what is maximum. So look at this image here. We have seen that electromagnetic spectrum consists of energy components. What are those energy components? We have seen in an increasing order of frequency and energy. These are the components. So if I'm your examiner, I will ask you, which of these components of the electromagnetic spectrum has the least frequency and least energy? Can you tell me? So least frequency and least energy will be what? Your radio waves. So this is the least frequency, least energy, isn't it? Then you come to microwaves. Your microwave ovens is also energy. Your infrared, all your remote controls. Then you come to light, ultraviolet rays. X-rays are towards the higher side of the energy and frequency range. And what is the component of the electromagnetic spectrum that has the highest frequency and energy? So highest frequency and energy. So highest frequency and energy is what? It is gamma rays. So least frequency and energy is radio waves. Highest frequency and energy is gamma rays. Now few specifics about X-rays that we must know. So X-rays, we have seen they have high energy and also a high frequency. That is what we have seen along the spectrum. What is the wavelength of X-rays? So the wavelength of X-rays is around 0.01 to 10 nanometers. So 10 nanometers. So 0.01 to 10 nanometers. What is the energy content of X-rays? So the energy content of X-rays can range from 100 electron volt to 100 kilo, that is 1000 electron volts. So these are a few specifics about X-rays that we must know. Now questions have been asked on the properties of the electromagnetic spectrum. We have just seen one property, that it is comprised of energy components, which means that it is not comprised of particles. No particle can be a part of electromagnetic spectrum, because what are the components of electromagnetic spectrum? They are just energy components. And because particles are not a part of the electromagnetic spectrum, remember, mass is a property that electromagnetic spectrum components do not have. They do not have mass, remember. That is because particles have a mass, isn't it? Particle has a mass. Alpha particle, as an electron particle, which is a beta particle, has mass. Does light have mass? No, light is what? Light is energy, isn't it? Therefore, and because all the components of electromagnetic spectrum are what? They are energies, so they don't have mass. So mass is a property that none of the components of the electromagnetic spectrum has. They don't have mass. What about velocity? All these radio waves, right, gamma rays, X-rays, visible light, they travel at the same speed or velocity. At the same velocity, that is the speed of light. What is the speed of light? Do you remember? Yes, it is 3 into 10 raised to power 8 meters per second. So all the components of the electromagnetic spectrum that we just saw, they all travel at the same speed or velocity. What about the type of wave? Now there are different types of waves. See, this is one type of wave, crest and trough, crest and trough, crest and trough. This could be another type of wave, compression, rarefaction. Compression, rarefaction. All the components of the electromagnetic spectrum travel by the same type of wave, and that is usually this crest and trough, crest and trough, crest and trough. Okay, so what have we seen about electromagnetic spectrum? We have seen that they comprise of energy components. What energy components? We have seen least frequency, least energy is radio waves, maximum frequency, maximum energy is gamma rays. We have discussed few specifics about X-rays. Because they are energy components and not particles, they don't have any mass. They travel at the same speed or velocity and by the same type of wave. Now let us jump to these important terms. Now these are atomic jargon terms. And why are they jargon terms? Because we have been studying them right from our school days, but still we don't remember them well. Now that is because we have been studying them wrong, right? We have been mugging them up. And remember, whenever you mug up something, it is highly likely that you're going to forget it. So what I'm going to do is I'm going to spend 5 minutes on these particular terms, and I'm going to apply what is called as the mnemonic secret. This is a smart work technique to remember things. What is the mnemonic secret? Remember, mnemonic secret is that the answer to a particular question lies in the question itself. How is it possible? How is it possible that the answer lies within the question itself? I'll give you an example. Look at the first two words, isotopes and isotones. They are very similar to each other, isn't it? Right? So they're very similar to each other, except that they differ in the terms of only one letter. And what is that letter? Right? So that is a P in isotopes and an N in isotones. That's it. That is your answer. Answer lies within the question itself. How? Look now. Iso means what? Both of them have iso. Iso means what? Iso means same. And what is unique in this word? It is a P. Remember, P stands for protons. So can you tell me what are isotopes? Isotopes are those that have the same number of protons, but they have different number of neutrons. Those are called as isotopes. Now similarly, can you tell me what are isotones? Iso means same. N now stands for neutrons. So what are isotones? Isotones are those that have the same number of neutrons, but they have the different number of protons, isn't it? So can you believe now the answer lies where? The answer lies within the question itself, the term in front of you. Now let us apply this to isobars. Now in isobars, I want you to focus on the half of the word that is the bars or a bar. Now if you visit a bar, say on a weekend, I'm not suggesting you visit a bar, but if you happen to visit a bar, what will you see? Especially on weekends, you'll see that these bars are very crowded places. Why? Because people from all over the city, from different parts of the city and the town, are going to converge to a place called as a bar, and they're going to drink away all their stresses. So what happens? If you look at these people sitting inside a bar, if you observe them, you'll realize that they are very different people, right? They come from different parts of the city. They have different educational qualifications. They lead different kinds of lifestyle. They have different types of jobs, right? Though their life is individually so different from one another, all of them have converged to that place called as a bar because they have one particular property in common. And what is that? They all drink. So isobars are like people sitting inside a bar. If you see individually, they are very different from one another, but they have one particular property in common. What have we seen in isotopes and isotones? We saw that one was same, one was different. Here I am saying they are very different. So isobars have different protons, different neutrons. But I said that they have one particular property in common. What is that? So if you add the number of protons and neutrons, protons are located in the nucleus, neutrons are also located in the nucleus. If you add them up, that becomes the total number of nucleons. And what is this term called as? In atomic basics, atomic physics, this is called as what? This is called as the atomic mass number. So though isobars have different number of protons, different number of neutrons, if you add them up, their sum is always the same. That is, they have the same atomic mass number. This is how you could remember it, right? So isobars are like people sitting inside a bar. They are very different individually, but they have one particular property in common. So what are isobars? They have different protons, different neutrons, but if you add them up, right, their sum, that is the atomic mass number, is the same. Now let us come to isomers. What are isomers? Just focus on the word isomers. In isomers, just focus on E and R. Remember that E and R stands for energy. And remember that they have different or unique nuclear energies. So they have a unique or different nuclear energies in spite of having the same atomic number and the same atomic mass number. So what are isomers? E and R stands for energy. So remember, they have different or unique nuclear energies in spite of having the same atomic number and atomic mass number. Let us quickly revise. What are isotopes and isotones? Iso means same. So same protons, different neutrons are isotopes. Isotones, same neutrons, different protons. Isobars, different protons, different neutrons, but if you add them up, they have the same atomic mass number. Isomers, E and R, they have unique or different nuclear energies in spite of having the same atomic number and same atomic mass number. So that is how you can use the mnemonic secret. The answer lies nowhere else. It lies within the question itself, which is right in front of you in the exam. So that is now you'll be able to remember it without mugging it up. Now let us focus on tungsten. Why is tungsten important? Tungsten is important because now we are shortly going to study the structure of the X-ray tube. And there we'll realize that tungsten is a very important component of the X-ray tube, right? Tungsten, remember, so few things about tungsten we must know. Tungsten, remember, is a transition metal. It is a transition metal classified in the periodic table as a transition metal. It has a symbol of W. It has an atomic number of 74. This was asked as a question in one of the JIPMER pattern exams, and it has a atomic mass number of 184. So few things about tungsten that we must know. Transition metal, atomic number 74, atomic mass number 184. Now radiation units is another thing that is very difficult to remember. Now I can simply give you a table and say that you need to remember the units of radiation exposure, absorbed dose, absorbed dose equivalents, radioactivity, and my job is over. I can literally wind it up in 2 minutes, but I don't want to do that because as a student I remember that when I used to try and remember all these radiation units, it was hell of a difficult task for me to do. So again, what I'm going to help you with is we are going to apply the mnemonic secret. What is the mnemonic secret? The answer lies within the question itself. So we'll be applying a little bit of logic here and there, have a little bit of fun, and in doing that, we'll ensure that it becomes very, very easy for us to remember all these radiation units. So let us start with the entity of radiation exposure. Question in your exam is, what is the conventional unit of radiation exposure? So for any entity, remember, there are two units, conventional unit and the SI unit, right? So conventional unit. What is the question? What is the unit of radiation exposure? So just focus on the question. Answer lies within the question itself. So just focus on exposure. Can you tell me, as soon as you look at exposure, I want you to realize who was the first person to be exposed to X-rays? Do you remember? First person to be exposed to X-rays was the person who discovered X-rays. And who was that? Röntgen. So Mr. Röntgen was first exposed to X-rays in his laboratory on 8th of November 1895, right? When he discovered X-rays. If you ask for documentary proof, who was the first person exposed? It was Mrs. Röntgen, isn't it? Mrs. Röntgen. So Mrs. Röntgen was first exposed, documented on film. So see, therein lies the answer. What is the unit of radiation exposure? It is the same person who was exposed for the first time. The answer lies in the question itself. And hence the conventional unit of radiation exposure is what? It is Röntgen. That's it. Now what about the SI unit? The SI unit is a very obscure unit, rather a useless unit, so to say. It is a unit which is called as Coulomb per kg. Coulomb per kg. Now let's try to understand what this means. See, X-ray is energy. When this energy enters into the body, it is deposited into the body. What does it cause? It causes ionization. So ions are produced. Physics, we know that ions have a charge. What is the unit of charge? The unit of charge is Coulomb. So Coulomb is what? It is this charge. It is this charge which is produced in the body, right? So why is this charge produced in the body? Because ions are produced. Why are ions produced? Because there is radiation exposure. Energy is deposited. So if I measure the amount of charge which is liberated in the body, it will give me an idea about exposure, isn't it? And if I measure it per unit of the body weight, and what is the unit of weight? It is kg. So that is how the unit Coulomb per kg was devised. That is what it means. But remember that this is a useless unit. Why? Because X-ray is a non-invasive investigation. If I have to measure the charge liberated inside the chest, when we do a chest X-ray, what I'll have to do? I'll have to insert metal electrodes inside the chest, which becomes invasive. And therefore, though this is the SI unit, it is not used clinically. What is used very commonly is Röntgen. Now just imagine this. Suppose that a patient is exposed to 100 Rontgen. But what is more important for me to know is out of this 100 Rontgen of exposure, how much was actually absorbed by the patient's body, isn't it? Because this is what is going to determine the adverse effects on the patient's body. And hence there is another entity in radiology, and that is called as absorbed dose. Let us apply the mnemonic secret. The examiner is asking you, what is the unit of absorbed dose? Look at the question. Answer lies within the question itself. So just pick up the first letter from both of these words. So you get A from absorbed and D from dose. So what do you have? You have A from absorbed, D from dose. That is the conventional unit, right? So can you think of a conventional unit, radiation unit, that has both A and D? Yes, it is. Correct. It is RAD. How is RAD formed? RAD in fact stands for what? RAD stands for radiation absorbed dose. That's it. So just by looking at your question, absorbed dose, A and D, you get RAD. That is the conventional unit. Now how to remember the SI unit? Let us apply some logic here. Let us have some fun here. Now this RAD sounds like a color, and that is a red color or a rad color, right? So it is, the name of this radiation unit is very similar to a color, that is red. And remember it this way: if rad is look like a color, the SI unit that goes along with it is another color, is also like another color. And what is that? It is gray. Remember, it is gray. So that is another SI unit. So that is another radiation unit. So how to remember the units of absorbed dose? Just look at absorbed dose. A and D will give you what? Rad. Right? Once you get rad, remember rad sounds like a color, that is red. So the SI unit that goes along with rad is another color. And what is that? It sounds like another color, and that is gray. That is how you can remember the units of absorbed dose. Now see, each tissue has different radiosensitivity. So a radiation dose, a same amount of radiation dose given to the, say, bone marrow, which is more sensitive, right? And the same amount of dose given to the brain, which is relatively radio resistant. Right, they will cause different effects on these tissues, right? Because the radio sensitivity of these tissues is different, and therefore we have to create a common comparing ground, right? And that is how there is another entity which is created, which takes into account the radio sensitivity of different different tissues, and that is called absorbed dose equivalent. Absorbed dose equivalent. So what is the examiner asking you now? Examiner is asking you, what are the radiation units or units of absorbed dose equivalent? Answer lies within the question itself. As soon as you look at this term, you focus on equivalent and you realize that the letter of highlight is E. So both the conventional unit and SI unit will contain the letter E. So what is the conventional unit? Conventional unit is called REM. What is REM? REM stands for radiation equivalent in man. That is how REM is created, radiation equivalent in man. And what is the SI unit? SI unit is Sievert. Both of them contain E prominently, isn't it? Both of them contain E prominently, and absorbed dose equivalent is telling us that E is the letter of highlight. That is how you can remember it, right? So remember, these are conventional and SI units of absorbed dose equivalent. So we have seen radiation exposure, first person exposed, Rontgen. So Rontgen and coulombs per kg, 2 units. Absorbed dose, A and D, rad and gray, 2 units of absorbed dose. Absorbed dose equivalent, E is the letter of highlight, so REM and Sievert, right? That is how the units are. Now there's another entity which is called radioactivity. Now there are 2 important scientists who contributed to radioactivity. It was actually Sir Henry Becquerel. Sir Henry Becquerel, that who discovered radioactivity for the first time. But it was also Madame Marie Curie, right, who worked extensively with radioactive elements, and she elucidated a lot of properties related to radioactivity. She used to carry these radioactive elements with her, right, to her home, to her working desk, Of course, in the laboratory, she used to carry them in her pockets. All these cooking books, her lab aprons, her table, her desk, chair, drawers, all are laden with radioactive elements even today. Right? So in the museum that was created in the honor of Marie Curie, they are all kept in a lead shield or a lead glass, even today, because they are so rich in radiation. She was unaware of the various adverse effects it could have. So she had very severe radiation toxicity as well. Right? She was awarded the Nobel Prize twice for 2 different contributions to science related to radioactivity. So though Henry Becquerel discovered radioactivity, Marie Curie and her husband Pierre Curie also worked extensively in the field of radioactivity. And as they say, ladies first, right? So if they ask you what are the units of radioactivity, the conventional unit is Curie, the SI unit is Becquerel. The conventional unit is Curie, SI unit is Becquerel. So these are the entire spectrum of radiation units that I want you to remember. Now let us move on to another important topic, and that is the topic of acute radiation syndromes. There are various types of acute radiation syndromes that have been described. Let me give you an example as to the clinical context as to why and how this happens. Suppose there is a CT scan machine, right? In the CT scan department, the machine is running. I'm not aware that the machine is on and a scan is going on. I simply open the door and I enter into the CT scan room. Now, because the machine is already running, my entire body is going to be exposed to radiation, isn't it? Yes, so there will be a large radiation exposure that occurs. Now tell me, will all the tissues in my body, be affected to a similar extent by that dose of radiation exposure? No, right? There are some tissues in my body which are more radiosensitive. They'll be affected earlier. There are some tissues in the body which are radio resistant. They'll be affected to a lesser extent, isn't it? And that is how at certain specific exposure levels, certain specific tissues in the body are affected, and this creates some clinical syndromes. These syndromes are called acute radiation syndromes. So these are acute hematological syndrome, GI tract syndrome, CNS or CVS syndrome. We'll study this as we go ahead. Though this looks like a factual topic, it is actually based upon a very important and beautiful core concept. And this was one of the recently asked questions in your exam, the clinical quiz that we started with. And that is called as the law of radiobiology, or law of Bergoni and Tribondieu. What is more important is the concept. What is the concept? It tells us which tissue will be affected earlier, which tissue will be affected later. So it says that which tissues in the body are radiosensitive. That is what it tells us. So radiosensitive tissues. Which tissues in the body will be radiosensitive? What does this concept say? It says that whatever tissue in the body that will have the maximum undifferentiated cells, or cells or highest fraction of cells in active mitosis. So see what this concept tells us. It tells us whatever tissue in the body that will have the cells which are maximum proportion of undifferentiated cells or cells in active mitosis, this is the tissue which will be a very radiosensitive tissue. So can you tell me which tissue is the one of the most radiosensitive tissues in the body? It is the bone marrow, because does bone marrow have undifferentiated cells, blast cells? Yes. Are these cells constantly dividing? Yes, hematopoiesis is going on. And therefore, do you realize now the first syndrome that is produced in the body, first syndrome to occur in the body is what? It is acute hematological syndrome. GI tract syndrome also occurs because in the GIT, it is the mucosal layer or the mucosal cells which are constantly dividing. They are constantly being replaced from the basal layers, right? So next is GI tract syndrome. CNS syndrome is one of the last syndromes. CNS, or for that matter even CVS syndromes, is one of the last syndromes to be seen in the body. Why? Because do they have any undifferentiated cells? No. They are highly differentiated cells. And are they involved in active mitosis? No. There is minimal mitosis of glial cells which is going on in the CNS. So therefore they are very resistant. So do you realize this? Why each syndrome is seen, on what sequence they are seen, is actually based on this concept of law of radiobiology or law of Bergoni and Trippontier. Now let us try and learn a few things about these radiation syndromes, because this was also a recently asked question. See, so they actually manifest themselves clinically in 4 stages. So how many stages total? There are 4 stages. This was part of the question that was asked. All of the following are true about radiation syndromes except. So how many stages they occur in? There are 4 stages. The first stage is called as the prodromal stage. This is also called as the nausea. This is also called as the nausea, vomiting, diarrhea stage. Nausea, vomiting, diarrhea stage. This extends from a few minutes to hours. So this is the first stage, prodromal stage, few minutes to few hours, right? Nausea, vomiting, diarrhea stage. Then comes the latent stage. Latent stage usually lasts from about few hours to few days. Then after the latent stage comes the actual manifest illness stage. This lasts from a few days to few weeks, and ultimately the last stage is going to be the recovery or death stage, which may last from a few weeks to certain years. So 4 stages: prodromal, latent, manifest illness, and recovery and death stage. Now let us look at individual syndromes. There are a few things about these syndromes that we must know. What are those? Acute hematological syndrome, we have seen, is the first syndrome to occur in the body, based on law of radiobiology we have just discussed. So because this tissue is very sensitive, right, it will happen at a lower dose. So what is the threshold dose at which it may seen? It can be seen at a threshold dose of around 1 to 2 grays. It can be seen at a threshold dose of as low as 1 to 2 grays, right? Because it affects the bone marrow, it results in pancytopenia. It results in pancytopenia, and ultimately what happens is that because there is pancytopenia, there are recurrent infections, recurrent hemorrhages which occur because the platelet counts are also low. So there are recurrent infections or there are recurrent hemorrhages, and this is the actual mechanism of death or cause of death in these patients. So these are a few things we must know about acute hematological syndrome. What is the next syndrome which is seen after acute hematological syndrome? Do you remember? It is the acute GI tract syndrome. And why is GI tract syndrome seen? Because I told you in GI tract, it is the mucosal layer, right, which is very sensitive. So it is shed off. That is called radiation enteritis, usually presents as diarrhea. Which is one of the first symptom which is seen. Threshold dose, now because it is slightly less sensitive than bone marrow, it is seen at a threshold dose of around 6 to 10 grays. So bone marrow hematological syndrome 1 to 2 grays, whereas GI tract syndrome is around 6 to 10 grays. So malaise, severe diarrhea, electrolyte imbalance can occur in acute GI tract syndrome. One of the last syndromes to be seen clinically is usually the CNS or CVS syndromes, threshold dose as high as around 20 grays. So threshold dose for hematological syndrome is 1 to 2 grays, for GI tract syndrome is 6 to 10 grays, for CNS syndrome it's around 20 grays. Death usually occurs due to circulatory collapse, raised ICT. So what are the mechanisms of death? Death in CNS CVS syndrome occurs due to, say, circulatory collapse or raised ICT. Raised intracranial tension, that is usually the cause for death. Now look at this recently asked question on the acute radiation syndromes. True statement regarding acute radiation syndrome is, it presents in 3 stages. Is it true? How many stages? We have seen how many stages? 4 stages, right? We have seen each stage, when and how it represents, in what time duration it presents, clinically manifests. So this is wrong. It presents in 3 stages is wrong. GI suppression occurs at a lower dose than that required for bone marrow suppression. Which is more sensitive, bone marrow or GI tract? Bone marrow, isn't it? So does GI suppression occur at a lower dose? No. Bone marrow suppression occurs at a lower dose. This is also wrong. Bone marrow suppression occurs earlier than neurological deficits is correct. Because bone marrow is more sensitive, bone marrow suppression occurs earlier than neurological effects. CNS is radio resistant, so it presents later. Bone marrow suppression occurs at 7.4 grays. No, bone marrow suppression is hematological syndrome occurs at hardly 1 to 2 grays, right? So that is also wrong. Hence, the answer to this particular question is C. Bone marrow suppression occurs earlier than neurological effects. This is based on the law of radiobiology that we have studied, right? So this was the recently asked question on radiation syndromes. Now, see, if we look at the overall effects of radiation on the body, right, it can be classified into two types. One is called deterministic and one is called stochastic. Now, I have introduced you to a mnemonic secret where I've said that the answer lies within the question itself, right? I've asked you to focus on words. Exposure gives us Roentgen, right? Absorbed dose gives us AND and RAD, right? So isotopes, isotones. So we have practiced this. When I really tried to apply this here, but these words, they are so heavy words, deterministic, stochastic, they don't give you anything. So then when I was not able to apply the mnemonic secret here, I decided that there must be some way in which I could simplify this for my students. And the way that I have come up with is that whenever you're trying to look at properties of deterministic effects and stochastic effects, I just want you to do one thing, and that is to remember their examples first. Because once you remember their examples, using those examples, we'll be able to remember all the various properties of these particular effects. So let us start with examples. What are examples of deterministic effects? All the acute radiation syndromes that we just studied. I have deliberately discussed it before I discussed this slide because I want you to know about radiation syndromes because we are going to use it here. All the acute radiation syndromes are deterministic effects. Radiation-induced cataract is a deterministic effects. Radiation-induced skin effects. Radiation-induced sterility, right? These are all examples of deterministic effects. Whereas radiation-induced cancer is a stochastic effects. Radiation-induced genetic mutations or chromosomal aberrations. These are all examples of stochastic effects. Right? Now that we know the examples, let us use these examples to remember the properties. Let us see how we can use it to remember the onset. Now see, I just told you that there are various stages of radiation syndromes. A few of them actually manifest within minutes to hours, isn't it? Right? A tissue which is very sensitive like the bone marrow will be affected very quickly, even at a lower dose. So can you tell me what will be the onset of radiation syndromes or deterministic effects? It is usually a acute onset. We are just using the examples. Now let us do this for stochastic effect. What is the example of stochastic effect? Cancer. Can you tell me how much time does it take for radiation-induced cancer to develop? It takes years and years and years for cancer to develop. The survivors of the atomic attacks of Hiroshima and Nagasaki continue to report malignancies many years after the atomic explosions. If there is a history of neck and chest irradiation in childhood, a child is exposed to neck or chest irradiation for some reason, then in these children, when they grow up after many years, the incidence of developing thyroid cancer or breast cancer is very high. So how much time does it take for radiation-induced cancer to occur? It takes many years. So what is the onset? Can you tell me now? The onset is, yes, the onset is subacute to chronic onset. What have we done? We have just used these examples to remember the properties. That is all that I'm doing. So actually you need to remember this table only till this point, only this much, because everything else below it, all the properties that you're supposed to remember, you're just be able to remember those by using the examples. Let us try this for threshold dose. So who has a threshold dose? Do radiation syndromes have a threshold dose? Yes, we studied. Do you remember? Hematological syndrome 1 to 2 gray, GI tract syndrome 6 to 10 grays, CNS CVA syndrome 20 grays. So all of these radiation syndromes and therefore deterministic effects, yes, they have a threshold dose. Is there a threshold dose for the development of cancer? The answer is no. I cannot say that a person exposed to 100 units or more will always develop cancer. Below it, he will never develop cancer. I cannot say that, right? So therefore, there is no threshold dose, right? Let us look at severity now. How do we assess severity? Now see, I'll give you an example. Suppose that we routinely do, in my department, we do a CT scan of the abdomen around say 15-20 patients every day. When we do a CT scan abdomen, right, the average exposure that occurs to the patient's body is around 10 millisieverts. Does anything happen to the skin of the patient when we do a CT scan of the abdomen? No, there's no effect usually seen. But what happens one day if there is a short circuit in the machine, and instead of the skin being exposed to say 10 units, the skin is exposed to 100 units? What will happen? If the skin is exposed to 100 units, the skin will become red, erythematous. So look at the skin effects. What is happening to the severity of the skin effect when the radiation exposure is increasing? Right, the severity is also increasing. Now instead of 100 units, let's say there is a short circuit inside the CT scan machine. There is an explosion and the patient's body is exposed to not 10, not 100, 1,000 units. What will happen? This is what happens in those nuclear accidents like Chernobyl. What happens? There is skin necrosis, skin ulceration, right, which will occur. So do you realize that the severity of the skin effect is increasing with dose, isn't it? And skin effect is what type of effect? Deterministic effects. So we know for deterministic effects, the severity increases with exposure dose. Right? Severity increases with exposure, right? Now, can I say this for cancer? Can I say that a person exposed to 400 units will develop a high grade of cancer as compared to a person exposed to 200 units? No. So, severity is not affected, or severity is not affected by dose. Severity is not affected by dose. Now, let us look at the risk-dose relationship. Now, one word of caution here before I go ahead. When I discuss this with my students, some students, they get confused between these 2 points. So I want to clarify it before I discuss the next point. What we have discussed now is severity. So whether skin effect when skin effect occurs, whether it occurs as nothing, no change, or whether it occurs as erythema, or whether it occurs as necrosis and ulceration, right? Now what we are discussing here is risk of occurrence, whether that effect will occur or not occur. That is risk-dose relationship. So severity to dose relationship we have already discussed is different from risk to dose relationship. Do you get that? I hope you get it. And now instead of using words, I'm going to draw a graph. So on the x-axis, I have dose. On the y-axis, I have risk of occurrence. We all know that deterministic effects have a threshold dose. So only at a particular dose or higher that the effect will be seen, and before that, lower than that, if the dose is, the effect will not be seen. So the curve of risk to dose relationship for deterministic effects begins at this point, which is nothing but the threshold dose, and then it is a curve like this. So this is the relationship between the risk and dose for deterministic effects. What about stochastic effects? So for stochastic effects, see, if this is dose, this is risk, is there any threshold dose? There is no threshold dose, right? So the graph will begin at 0 and it is a straight line and not a curve. So the risk dose relationship for deterministic effects begins at the threshold dose and it is a curve going ahead. But for stochastic effects, it begins at 0 and it is a straight line. Do you get that? So all we need to do when we try to remember deterministic and stochastic effects, so this was about the risk-dose relationship, all we need to do is to just remember the examples. By using those examples, just by using them as we have done here, you'll automatically be able to remember their individual properties as well. Now look at this term. There is a principle in the radiology which is called as the ALARA principle. ALARA stands for as low as reasonably achievable. So it is a principle that deals with radiation safety. So what does it mean? Whenever we are doing any investigation that involves radiation exposure to the patient, what should be the principle that we should follow? We should ensure that the radiation exposure that happens to the patient's body must be ALARA, as low as reasonably achievable. Don't you think that it should be as low as possible, isn't it? The answer is no. Why? Because if I make sure that the radiation exposure to the patient's body is as low as possible, then in such cases, right, though the radiation exposure is very low, the image quality will be compromised. I will miss my diagnosis on the image. So what is the purpose of doing the X-ray then? Right? Therefore, the principle of radiation safety says that the radiation exposure to the patient must be as low as reasonably achievable, right? So that the X-ray image quality or the radiographic image quality is maintained. At the same time, the radiation exposure is low. So this is what is the principle of ALARA. There is another rule I want you to know, and that is the 10-day rule. What is the 10-day rule? It was used in the olden days, and the purpose of the rule was that in young women in the reproductive age group, all X-ray based investigations should be done in the first 10 days of the menstrual cycle. Yes, this was an empirical rule, right? All X-ray based investigations in young women in the reproductive age group should be done when? It should be done in the first 10 days of the menstrual cycle. Why? Because we don't want to irradiate an embryo. Say in short cycles, ovulation and conception, fertilization may occur on day 11, 12, 13 sometimes, right? The ovulation standard occurs at 14 to 16th day. Sometimes in short cycles, it may happen earlier as well. We don't want to expose an embryo inadvertently. Right now, what is followed usually is that, right, instead of following an empirical rule, all technicians are usually trained to inquire with the patient before doing an X-ray whether there could be a possibility of the patient being pregnant. Right, so this question has to be specifically asked, and only then when we've ensured that there's no possibility for pregnancy, then an X-ray exposure can be done anytime throughout the cycle, right? But otherwise, empirically, this was called as the 10-day rule, and therefore there was a application of this particular question. The question was, what is the ideal time for doing a hysterosalpingography? What is hysterosalpingography? We cannulate the cervix, inject contrast. This contrast will opacify the uterine cavity, fallopian tubes. It will spill into the peritoneal cavity, right? That is how we ensure that the tubes are patent, right? So what is the ideal time for doing HSG? Right, HSG is done for evaluation of infertility patients, Mullerian duct anomalies, unicornuate, bicornuate, septate uterus, right? Tubal patency. Right, so again, as an application of 10-day rule, it has to be done, of course, in the first 10 days, but in the first 5-6 days when the menstruation is going on, we avoid injecting contrast to avoid the risk of infections. And so the best time to do an HSG is usually the 6th to the 10th day, because again, at 6th day, 5th, 6th day, the bleeding has stopped, and up to the 10th day, we are sure that there is no conception which has occurred, there is no embryo, right, even if it is a short cycle. So this is considered to be the safest period to do a hysterosalpingography, right? So this is about the 10-day rule. Now let us come to another very, very, very important topic at your levels, and that is, what are the radiation exposures in various modalities? See, the unit used here is millisieverts, right? So exposure, we know what is the unit, it is Roentgen, but why is not Roentgen used here? The unit of absorbed dose equivalent is used is because I told you, if there's 100 Roentgen of exposure, what is more important is out of this Roentgen, how much is absorbed, right? So that was the entity called absorbed dose. But then the absorbed dose in different organs is going to produce different effects. So we need to equate them. We need to create an equivalent dose so that when we are thinking about the radiation induced adverse effects, right, the equivalent or absorbed dose equivalent is more superior, and therefore the unit used here is millisieverts. Now see, it is good to see some vivid colors in a radiology class, isn't it? Because radiology is what? Radiology is all black, gray and white, right? Now, it is not that radiologists are primitive or backward because they use just black, gray and white, right? Radiologists are happy with using black, gray and white because, right? Because black, gray and white is sufficient for making a correct diagnosis. We will never use colors because we want the brain to appear beautiful, right? We use colors, right, only and only when those colors give us some additional diagnostic information. So if you think about it, what modalities in radiology actually use colors? Color Doppler. What is the role of color in color Doppler ultrasound? Color tells us the direction of flow, important diagnostic information. Red is towards the probe, blue is away from the probe, isn't it? Where else will you see colors? You'll see colors in PET scans, SPECT scan images, where the color map is actually giving you an information about the metabolic status of the cells. Blue is low metabolism, red, yellow is high metabolism. So radiologists use colors when those colors give us some additional information. So when I have used these vibrant colors on the screen here, on the slide here, I have used them deliberately because I want you to get a very clear-cut message about the various modalities here. Again, this is a very factual topic, very volatile topic. I can just give you this table, print it in your notes, and my job is over. But your job to remember all the radiation exposure values is very, very difficult, right? And therefore, I'm going to simplify it for you. Whenever you are trying to look at radiation exposure in various modalities, just classify those modalities into 3 zones: green zone, yellow zone, red zone. What is green zone? Green zone is the zone of spot radiographs. So these are safe investigations. What are spot radiographs? These are, investigations when the patient is exposed to X-rays only once or twice. Chest X-ray PA view. How many times is the patient exposed to X-rays? Only once. But when I do a wrist AP and wrist lateral, how many times is the patient exposed to X-rays? 2 times. So if the patient is exposed once or twice, they are called spot radiographs. Now in certain techniques like IVU, intravenous urography, patient is exposed multiple times, right? These are called diagnostic procedures. They are yellow zone or warning zone. So spot radiographs are safe because they are exposed, patient is exposed only once or twice, low radiation exposure, green zone or safe zone. But in diagnostic procedures, how do you do an IVU? First, we take an X-ray abdomen to look for renal calculi. See, 1 exposure. Then we inject contrast intravenously. As soon as we inject contrast, we take another exposure, 2 exposures. Then that contrast goes into the arteries, renal artery, comes to the kidney, gets filtered at the glomerulus, renal tubules, renal pelvis, calyces, pelvis, ureter, bladder is opacified. We follow this. How do we do it? So, plain film, 0-minute film at injection of contrast. Then we want to trace this contrast as it comes into the kidney and opacifies the kidney. So 5 minutes, 10 minutes, 15 minutes, 30 minutes, full bladder at 1 hour. Then we ask the patient to void urine and then again post-void. How many times is the patient exposed to X-rays? Multiple times, isn't it? So radiation exposure is going to be logically high. So therefore, diagnostic procedures are in the warning zone or yellow zone. Something that you must remember very vividly as you go on with your clinical practice is there are certain, modalities which are in the red zone. These are dangerous modalities. You must always be cautious while doing them. And what are the danger modalities? These are CT scan, PET scan, and radionuclide studies. These are all in the red zone, danger zone, because the radiation exposure is very, very high. Now, what have we seen? All modalities that we use can be classified as spot radiographs, green zone, safe zone, diagnostic procedures, yellow zone, warning zone, and PET scan, CT scan, PET scan, radionuclide studies, red zone or danger zone, because the radiation exposure is going to increase from bottom to the top, from the green zone to the yellow zone to the red zone. Now, instead of remembering the values of all the 15, 20 different types of, tests, let us remember only a few of them, and they are very important. Look at all these spot radiographs. What can you see? Limb X-ray, joint X-ray. What is the least exposure overall? In spot radiographs, least exposure occurs in limb X-ray or joint X-ray. It is as low as 0.01 millisieverts. Then comes just above it, chest X-ray PA view, most common radiology based investigation done. You must know its value. Chest X-ray PA view, radiation exposure is how much? It is 0.02 millisieverts. And then we come to lumbar spine. Highest among spot radiographs is what? It is lumbar spine. Its exposure is around 1 millisieverts. So what have we studied? Green zone, limb X-ray, joint X-ray 0.01, chest X-ray PA view 0.02, and lumbar spine 1. Now in diagnostic procedures, look at the various diagnostic procedures: MCU, barium swallow, barium meal follow through, intravenous urography, pylography, the example that we use to understand what are diagnostic procedures, and barium enema. Now in this, remember that just remember the exposure values for minimum and maximum. So MCU is what? Micturating cystourethropy. Micturating means while the patient is passing urine, an X-ray is taken, that is called micturating cystourethropy. Contrast is filled in the bladder, patient is passing urine, at that time you take an X-ray, that is called micturating cystourethropy. Exposure value is around 1.2 to 1.5 millisieverts. Barium enema, highest among diagnostic procedures, is around 7 millisieverts. Then we come to CT scan, PET scan and radionuclide studies. Out of this, I want you to remember few very important values. So CT scan head or brain is around 3.5. So you'll say, sir, barium enema is 7, CT head is 3.5. How is it in the red zone? Because this is a concept that I am giving you. Remember also, in CT scan, there is a radiation exposure that occurs from all around, everywhere around to the patient's body. So there is a greater risk to the organs. Whereas in barium enema, it is only a one-sided exposure, can be easily shielded. Gonads can be shielded by a lead, layer, but it is very difficult to shield when doing a CT scan. Therefore, CT scan is more dangerous. CT scan head, therefore, is 3.5. CT scan thorax is around 8. CT scan abdomen is around 10 millisieverts, and PET scan is around 25. Just see how large it is, right? So in this table, what have we studied here? We have studied that all the modalities can be classified into green zone of spot radiographs, which is safe, yellow zone of diagnostic procedures, which is a warning, and red zone of CT scan, PET scan, radionuclide studies, which are dangerous, right? Always try to classify modalities like this. Then we have discussed that the radiation exposure is increasing from green zone to yellow zone to red zone. And then we have discussed, and we'll try to remember only few values. Let us quickly revise them before we go ahead. Limb X-ray, joint X-ray, what is the exposure value? 0.01 millisieverts. Chest X-ray PA view, it is 0.02. Lumbar spine X-ray, it is 1 millisieverts. If we come to diagnostic procedures, MCU is around 1.2, barium enema is around 7. CT scan, PET scan, very important. So CT head is around 3.5, CT thorax is 8, CT abdomen is 10, and the overall highest or maximum radiation exposure occurs in what? Occurs in PET scan, and the overall exposure is considered to be 25 millisieverts. That is the most highest one. Now these are about the exposures. Do you remember the question that we started with? A patient who was pregnant was exposed to chest X-ray. So what is the exposure in chest X-ray? It is 0.02. But how much is actually allowed during pregnancy? That is the next topic that we are going to study, and that is what are the radiation exposure guidelines. These guidelines have been issued by the International Commission of Radiological Protection or Radiation Protection, and also the International Commission on Radiation Units. What do they say? So they have defined different guidelines for public exposure and for occupational exposure. Naturally, the limits for occupational exposure are higher, right? Because these, occupational workers are constantly being exposed. So there is a exposure levels that have been defined, which are higher for occupational exposures. Now, for effective dose overall, right? Effective dose overall to the entire body. For public exposure, for the normal public, the limit is around 1 millisieverts per year. 1 millisieverts per year is the exposure limit for public exposure. For occupational exposure, it is around 20 millisieverts per year, averaged over 5 years. So if it is 20 millisieverts per year, for 5 years, it should be less than 100 millisieverts. Now it can happen sometimes that in a particular year, the exposure is high. How is this? Is this allowed? Yes. It can be allowed up to 50 millisieverts in 1 year for occupational exposure, provided that, however, in 5 years, the dose does not cross 100 millisieverts. So for occupational exposure, 20 millisieverts per year, 100 millisieverts for 5 years. Okay. But sometimes if the exposure is large, it is allowed up to 50 millisieverts in 1 year, provided that in 5 years, the dose does not cross 100 millisieverts. This is for routine exposure effective dose for public exposure and occupational workers. Now we come to specifically to the lens of the eye. So if your examiner asks you for the lens of the eye, the permissible limit for public exposure is 15 millisieverts. And for, occupational exposure, it is 150 millisieverts. For if they specifically ask you for skin exposure, then the permissible limit for public exposure is 50 millisieverts. But for occupational exposure, it is 500 millisieverts for skin. So for lens, it is 15 and 150. For skin, it is 50 and 500 millisieverts. Now, if they specifically ask you for pregnant radiation workers, so even for radiation workers or occupational exposure where the limit is higher, right, what is considered to be safe in pregnancy, or exposure of 1 millisieverts should not be exceeded. Now, do you remember? In chest X-ray PA view, what is the exposure? In chest X-ray PA view, it is 0.02 millisieverts. And what is permitted? 1 millisieverts. So therefore, if a pregnant patient is inadvertently undergoes a chest X-ray, right, then what is it safe? Well, theoretically, right, there are risks involved, but if you look at the exposure values, considering the exposure values, it is considered to be safe, right? So we try and avoid it, but accidentally it happens. It won't affect the pregnancy in a very significant manner. Now, if your examiner specifically asks you about the AERB guidelines, so Atomic Energy Regulatory Board. So what are we have studied here? These are international guidelines. But if your examiner specifically asks you about the Indian guidelines, then we must refer to AERB, Atomic Energy Regulatory Board of India. Now, these are extremely similar, right? There's only one difference. Everything is similar. There's one difference. What is the difference? Internationally, maximum exposure in 1 year allowed is 50 millisieverts as long as the total exposure does not exceed 100 millisieverts, right? We have studied this. In India, AERB says that the maximum exposure that can be allowed in 1 year is 30 millisieverts, provided that in 5 years the exposure must be less than 100 millisieverts. So internationally they say 50 millisieverts is allowed, provided in 5 years it should be less than 100. Okay, but what does AERB say? 30 millisieverts 1 year is only allowed, provided that in 5 years it must be less than 100. That is the only difference between the Indian standards and the international standards. Okay, so this is you need to know as far as the exposure guidelines are concerned. Then, whenever we do an X-ray, on the X-ray unit or console, there are certain exposure factor knobs that we are supposed to change. Let us consider these exposure factors. These are called KVP and MAS. What is KVP? KVP stands for kilo voltage peak. Kilo voltage peak means what? It is the potential difference which is applied across the X-ray tube. So it is the tube potential or tube potential difference across the anode and cathode within the X-ray tube. So what does it affect? It affects two things. Remember, when we change the KVP, it affects two things. One, it affects the penetration of the X-ray beam, and two, it affects the contrast of the image or the image contrast, you can say. How does it affect penetration? It affects penetration directly. So a low KVP will lead to low penetration because it is directly proportional, isn't it? But a high KVP, right, will give rise to high penetration, directly proportional to penetration. So a thin patient, I will use a low KVP. For a heavy patient, I will use a high KVP. I need more penetration. But it also affects contrast, image contrast. So it affects image contrast inversely, right? So a low KVP will give rise to a high contrast, whereas a high KVP, because it is inversely proportional, isn't it, will give rise to a low contrast. So this is how KVP will affect the image, right? Now therefore, to compensate for these changes, there's another exposure factor which is available, and that is called MAS. MAS is nothing but milliampere second. Milliampere second. So this is nothing but the current which is passed through the cathode filament. So it is the current which is passed through the X-ray tube or the tube current or the cathode filament in milliampere seconds. What is the milliampere and for how many seconds? Now this basically determines the film blackening. So this determines what? It determines the film blackening. This also determines how many number of X-ray photons are there in a beam. So it determines the number of X-ray photons in the X-ray beam. This is what it determines. And how does it affect the image? That is very important for us. It determines film blackening, so it affects contrast, right? So how does it affect contrast? MAS mainly affects the image contrast, and it affects the image contrast directly, remember. So a low MAS will give rise to a low contrast film, whereas a high MAS will give rise to a high contrast film because it is directly proportional, right? This is what we need to know about the implications of the exposure factors of KVP and MS. We'll discuss more about it when we go to the X-ray tube discussion and its functioning. Two important symbols that you must remember, try to form a visual impression. So this is the International Radiology Symbol or the trefoil. If you look at your X-ray rooms or CT scanner rooms, right, they'll have this symbol outside it so that, you know, the patients as well as the staff, you know, everybody who visits that particular room is aware that they are entering a radiation zone. So this is the international radiation symbol and they should be careful. Then in certain equipments which are used in very high level, radiation, such as in nuclear reactors, in sealed sources basically. So this is basically used for sealed sources which can be used in nuclear reactors, power plants, right? A high level sealed source ionizing radiation symbol is used. So this has been approved by the International Atomic Energy Agency, International Organization for Standardization also, right? So what it basically shows is that, see, inside that red triangle, you see this is radiation, right? So they say it is danger and you should move away from this source. That is what this symbol basically means, right? So it basically shows us that there is radiation inside it, it is dangerous and you should move away from it. So that is what this symbol is. So two symbols, one is international radiation symbol, the trefoil, and sealed source ionizing radiation symbol. This is something that I want you to know. So coming back to where we started, right? See, 32-year-old patient undergoes a chest X-ray. She is pregnant. What to do? Now, what is the permissible or allowed radiation exposure in pregnancy for radiation workers? It is 1 millisieverts. In a chest X-ray PA view, what is the actual exposure which is occurring in a chest X-ray PA view? 0.02 millisieverts. And this 0.02 is happening where? It is happening to the chest. Where is the pregnancy? Pregnancy is in the pelvis. So if any X-ray beam has to reach the pelvis, it will first enter the chest, gets scattered and then goes into the pelvis. So for the pelvic pregnancy to the uterus, the exposure will be even less than 0.02. So what will is less than 0.02, significantly less than 1 millisieverts? Yes. And therefore, are there any significant effects which are going to be happen, which are to be expected? The answer is no. So this patient has to be counseled. This patient has to be reassured and has to be advised to continue with the pregnancy. However, because there are theoretical risks, however low they are, right, we must always try and avoid this from happening, prevent this from happening. But if it happens, it's okay to counsel the patient, reassure the patient that nothing is expected to happen and you can safely continue with the pregnancy. So this is based on two topics. One is what are the permissible doses? We have studied the guidelines. And second, green zone, yellow zone, red zone. What are the actual exposures occurring in various modalities? Yes, so this is what is based on these two topics. Yes. Now see, a child with acute lymphoblastic leukemia undergoes prophylactic irradiation prior to hematopoietic stem cell transplant. Which of the following will be the least affected by radiation? So this is based on law of radiobiology. So all factual seeming questions in radiology are actually based on underlying concepts. Remember, this is the point that I want you to realize here. So we are going to focus more on concepts as we go ahead in this discussion. So what does law of radiobiology say? It says that those tissues which have the highest undifferentiated cells or cells in active mitosis will be most sensitive. So they have asked least affected by radiation. Spermatogonia, yes, they'll be affected. Intestinal epithelial cells, mucosal cells will be affected. bone marrow, erythrocyte, precursor cells or blast cells constantly dividing, they will be affected. But neurons are highly differentiated cells which do not undergo rapid cell division normally, and therefore the neurons are expected to be the least affected. This will be the answer in this particular question. Yes, so okay. Now Laurel and Hardy were brought in for a chest X-ray. So Laurel is a very thin built guy, Hardy is a very heavy guy. So Laurel's X-ray was done at 80 kV, 6 ms. Considering Hardy's body habitus, now Hardy is a very heavy guy, right? A healthily built guy. So what we need, first thing we need increased penetration, isn't it? Increased penetration. Penetration is determined by what property? Penetration is determined by KVP, directly proportional. So we need increased KVP, right? So increased KVP is what we need. Yes. So these two could be the answers. But when we increase KVP, we know that KVP is inversely proportional to contrast, so it will decrease the contrast, right? So we have MAS, but we know MAS is directly proportional to contrast. Because we are using increased KVP, it is going to decrease the contrast of the image. It is inversely proportional. So we try and compensate to it. How? By increasing the MAS. Because if we want to increase the contrast is directly proportional to MAS. So we have to increase the MAS. So this is the best combination. So what we have to do? We have to increase the KV to increase the penetration, and to compensate for the loss in contrast, we also increase the MAS. So the contrast is also increased by increasing the MAS, and hence the best answer in this particular question is B here, right? So friends, believe it or not, this is just a very early peek into what we are going to do with radiology. I hope you realize that each and every seemingly factual question or topic in radiology is actually based on a very beautiful core concept. My job here is not to just tell you these facts, but rather, make you understand these concepts. Because once you get these concepts, solving various application based questions in radiology is going to be a very, very, very easy thing for you to do, right? So I hope you have enjoyed this conceptual discussion, right? We are going to build on these concepts as we go ahead.